and become smaller. See, this is the terminal hair, and this is a biopsy. This is taking a little punch biopsy from the scalp, and you can see here the thick terminal hair and the color, and look at the vellus hair. Very fine, thin, less pigmented hair, and that's what's happened in androgenetic alopecia. So these clinical studies have also shown that men have problems. They feel less attractive, decreased sexual confidence, decreased self-esteem, and of course younger men and the ones that have significant amount of hair loss, this is common sense, probably are more affected with the problem, and they're more concerned. Now, remember the pictures when I show you the way women lose their hair, and they hardly ever lose the frontal hairline completely. You know, they become thin on top, or they develop that Christmas tree pattern that we talked about. With men, it's completely different. With men, they have progressive recession in the temporal area that keeps going further back. They also lose hair in the coronal area, and to the point where they lose all their hair in the scalp and in the back completely. And this is what we use when we do studies on hair loss to measure and evaluate at what point in their hair loss stage are these patients. So in men, the family history is very important. You will find that somebody in their family had androgenetic alopecia. In either side of the family, the mother or the father or an uncle or a grandparent, somebody had. And you will see that there's miniaturized hair follicles, and they usually have that M-shaped pattern in the front. And that's how you diagnose androgenetic alopecia. Now, how about treatment? Unfortunately, in spite of the amount of research that's being done today, there's a lot of research. A lot of the pharmaceutical companies are spending a lot of money on research. We really don't have a lot of treatment for it, and there's not a lot to do. There's only 2 drugs that have been approved by the FDA that actually have shown and proven that they do something for hair loss. And these are minoxidil, which comes in 2% and 5% topical. It used to be prescription until a couple years ago. Now you can buy it over the counter because they found it was safe enough for people to use it over the counter, and it did not have systemic effects, and you can get it over the counter now. But it's minoxidil, which is a topical solution. One of the original brand names was Rogaine, but now you can get it with a whole bunch of different names. Walmart has it, and a lot of the different pharmacies have generic, and the drug is called minoxidil. So a lot of them have minoxidil. The other one is Propecia, which is finasteride, and finasteride has also shown to reverse hair loss. And if that doesn't work normally, we recommend a hair transplant if you're really upset about it. And there's a lot of research going on hair transplants, because they're doing even single hairs. They're doing eyelashes transplants, making your eyelashes longer, creating eyebrows. There's a lot that can be done aesthetically if you're interested, and the minoxidil and the Propecia, if they don't work by their own, you can go and have hair transplantation. Now, approved treatment for women, the only one is minoxidil topical solution. Again, they're doing very sophisticated work with hair trans, with surgical procedures on women, and of course hair pieces and prosthesis. Now, the way minoxidil works, because minoxidil does work, so the sooner you get it, the better it is, because you don't allow that hair to become such a miniaturized thing.